The days and weeks following your birth are incredibly rewarding and can be uniquely challenging. Just like in pregnancy, your body will undergo impactful changes during the postpartum period. This video will cover what to expect when you are postpartum. Immediately after delivery, your body is filled with hormonally driven changes. You may experience a number of sensations such as total body shakes, milk letdown, or uterine cramping. Important changes continue in the following days and weeks. We'll talk about what to expect for bleeding, pain, breastfeeding, and emotional self-care. In either a vaginal delivery or a cesarean section, it can be normal to bleed up to 1 liter after delivery. Your uterus will contract into your pelvis to help slow postpartum bleeding. Breastfeeding further stimulates your uterus to cramp and contract. Medications can be given to help further reduce bleeding if needed. It is normal to continue to have a period-like bleed for 6 to 8 weeks postpartum, although many women stop bleeding after a few weeks. Delayed postpartum hemorrhage is rare, but if you experience heavy bleeding, filling a pad an hour continuously for multiple hours, it is important to seek emergency care. After a vaginal delivery, ibuprofen can help reduce uterine cramping pain. It's normal to have a small tear in the vagina or perineum, which is the part of the body directly under the vagina, that is repaired immediately after delivery, and often there is swelling of the labia or perineum in the hours and days after delivery. An ice pack, acetaminophen, and ibuprofen are helpful and safe ways to reduce pain. If an epidural was given during labor, it may take a few hours for it to fully wear off. The amount of pain to expect in the first few days after delivery is widely variable. Recovery typically takes longer after a first birth, or if it was a difficult delivery, or if there are other complicating factors. If birth was via a cesarean section, it is expected that there will also be incisional pain, usually requiring ibuprofen, acetaminophen, and opiates to manage. Even after a cesarean section, most patients are able to walk around within 6 to 12 hours of delivery and are on the road to recovery. Persistent severe pain can be concerning and should be assessed by a healthcare provider. Your baby will likely be ready to eat within a few minutes of being born. Uninterrupted skin-to-skin when possible, as well as early lactation support and avoidance of formula will all help improve the success of breastfeeding. If baby has a good latch, feeding should not be painful. As your milk adjusts to your baby's needs, breast engorgement may occur. Feeding your baby or pumping will improve breast discomfort and reduce the risk of infection. Your baby's stomach is very small at birth, so it's normal for baby to feed frequently. Every day, your baby's stomach grows, allowing for slightly more time between feeds. In the first few weeks, it's normal for baby to wake up for a feed every 2 to 3 hours. It's important to prioritize your needs between feeds, inviting others to help with baby so that you can rest and recover. Sleep deprivation, hormonal shifts, physical recovery, and situational isolation can all contribute towards making the postpartum period an emotionally vulnerable time. For this reason, it is important to benefit from the support of family and loved ones. Postpartum blues are a temporary feeling of exhaustion, overwhelm, and tearfulness in the absence of depression, and most commonly resolve within a week or so. When these symptoms persist and worsen to impact a patient's ability to care for herself and her newborn, it is important to consider postpartum depression as a possible diagnosis. Approximately 1 in 10 women will experience postpartum depression. If your mood is impacting you on a daily basis, reach out to your obstetrics provider for a prompt assessment. Early recognition and supportive counseling and treatment improves outcomes for patients and their babies. Every patient's postpartum experience is a unique journey, but knowing what things to expect and look out for can be helpful. As always, know that your treatment team here at UC San Diego Health is here to help support you every step of the way.